Hello, I'm Peter Carazone. I'm a physician at Vanguard Medical Group. You may have surmised that since I'm wearing a stethoscope, have a white coat on, even a Vanguard logo. I'm here through Zoom, which many of you have become accustomed to out of necessity over the last 2 months. I'm also president of Vanguard Medical Group. As such, I want to wish you well. I know this has been a trying time over the last 2 months. I know many of you have been affected by COVID-19, either through having the disease yourself or knowing someone that's had the disease. Some of you, unfortunately, may have known someone that has passed away from the disease. It's affected us physically, emotionally, and economically. It's almost as if we're in a bad science fiction movie and we're all role players, and it's not science fiction. This is real, and it's changed our lives. We're all social distancing, staying at home for the most part. We're all being careful, going to the grocery store for the ones that are well enough to do that with masks on to protect ourselves. It's been a terrible journey that we're all adapting to. The good news is the rate of COVID-19 in New Jersey seems to be coming down. And I'm optimistic over the next few months that some of our barriers will be loosened, but COVID is not going away. We need to continue to be vigilant. You need to continue to protect ourselves. At Vanguard Medical Group, we prioritize your safety. If you come into our offices now, you will see someone wearing, at minimum, one of these, a stage 1 mask, or possibly an N95 mask that we wear to protect ourselves more safely. If there's a chance you have COVID or something imitating COVID, we'll dress in full gear, including face shields. We're here to protect our staff and to protect you. When you're coming into the office, we expect you to wear masks as well. That will reduce any significant transmission of the disease. In addition, we ask for people not to come to the office without calling first. We need to triage your visit. If you're sick, we do not want people to walk in haphazardly and expose our staff to the illness or other patients that may be in the office to the illness. We have changed our workflows within the office to ensure your safety if you do come to the office. Workflow changes include ill patients. Some are being seen in a car or even being swabbed in a car and not coming into the office at some offices. Some offices have different entrances for sick or well. If you need to come in, we want to make sure we're putting you to the right entrances. Make sure you read signs that are well posted on any of the doors of the offices. We're open. We've been open. Throughout this crisis, we've been here for you. I know many of you have tried to stay at home and stay away, but we've helped many patients for over the last 2 months with COVID-19. Some of us gone to the hospital for patients with COVID-19, and we continue to take care of anyone that has that illness, plus your regular medical conditions. We want to make sure that you do not hesitate to come in if you have a medical problem. There's been reports from the emergency room that people have delayed illness because of the fear of COVID. And that fear itself is creating a problem. People come in sicker and may have irreversible damage if they had a heart attack or if they have breathing problems because of the delay. In fact, delaying seeing a primary care increases your chance of getting into a hospital, which is the last place you want to be with this epidemic. So we encourage you and plead with you, if you're sick, call us. We can do a televisit. 70% of our visits 2 weeks ago were through televisits, similar to what I'm doing right now through Zoom. These are easy. Anyone can do it. If you have a smartphone, you can do it. If you don't have a smartphone, if you have a son or daughter that has a smartphone, we can do it. If you don't have any of those, some insurances are actually reimbursing Medicare, Horizon, to do phone visits to help you through some of these issues. please do not put yourself as exposed to any illness because of the fear of COVID. At Vanguard Medical Group, we have a slogan: we take care of our people. That actually has a triple entendre. The three phases is: one, we care for our staff because we want to protect our staff. We care for our community, but most importantly, we care for you. You, our patients, you are our people. We want you to be safe. Please be safe, be smart, do not delay any personal health issues, and please, if there's any issues, do not hesitate to contact us, be it physical, emotional, or otherwise. We're here for you. And with that, I am going to mask up and head back to work. Thank you.